We've been covering breaking news this morning from Washington, D.C., where the federal government says it will reclassify state-licensed medical marijuana. Now, it used to be Schedule 1. That's the same as meth, heroin, and other addictive drugs. But now it'll be Schedule 3, which means fewer regulations and a lower perceived risk of addiction. 9 News medical expert Dr. Kohli joins us live over Zoom this morning to talk more about this decision. So for starters, in layman's terms, doctor, what does this change mean exactly?
Drew, this is a really big deal in the medical community because we're changing something from, equivalent addictive potential to heroin, no medical uses, that's Schedule 1, to Schedule 3, which means that it has moderate to low addictive potential. And, it's something that we routinely use in the medical community. So as an example, you mentioned, obviously heroin is a Schedule 1 substance. A comparable Schedule 3 substance would be testosterone supplements, for example. And I have to be honest, the implications of this are, of course, that we can do more research. But as you alluded to, this really does mean that people will start to perceive this as a safe medication. And I don't think the jump from 1 to 3 was appropriate. I think really it should have been a 1 to 2. So it should have been a Schedule 2, more along the lines of something like morphine, which of course has appropriate medical uses, but also has that addictive potential. So I think that this is going to confuse the message for a lot of people out there, especially I worry about our teenagers and our adolescents who might start using marijuana recreationally, thinking that it's a safe drug to use.
I do want to ask you more about your personal take on this, but before I go there, let me ask you about the different rules we've seen at the state level versus the federal level when it comes to drugs. Why is that?
Yeah, so some of it is logistics. So the idea here is really to give states the autonomy to be able to make public health decisions on their own. And really the implications of changing something from Schedule 1 to Schedule 3 are that federally marijuana is still regulated by the federal government, by the national government, but states can choose to do something different. And research dollars are still determined by the federal government, but this does have implications as well for insurance coverage, as you can imagine. So if we're talking about using medical marijuana, the state and federal, both having different policies, can certainly affect insurance coverages, especially for some of the national payers. So I think research, tax, and insurance are the 3 major implications of the fact that there's discordant policies. But the philosophy behind having different policies is that states should really be allowed to make a lot of important public health decisions on an individual level. And as you know, Colorado legalized recreational marijuana back in 2012, but we've certainly had medical marijuana for some time now.
All right, let's get back to the doctor's personal thoughts. With this ruling today, the FDA basically suggesting that people are less likely to abuse marijuana than they would some other drugs. Do you agree with that?
Yes and no. So let's say what you're comparing to. So if you're comparing it to heroin, of course, marijuana's got significantly less addictive potential than heroin. It has fewer withdrawal symptoms. So when you stop using it, you don't have as many systemic symptoms that could potentially be life-threatening. But psychological dependence and addiction are very slippery slopes. And so if you're comparing it to something like testosterone, which is also Schedule 3 substance, it's not less addictive. It is much more addictive than testosterone. So I think it really depends on what you're comparing it to. So I do agree with changing it from Schedule 1, which means it doesn't have any known medical uses, because there are some appropriate medical uses. But moving it to Schedule 3, I think, is a bit aggressive. And I really think we should certainly have put it as Schedule 2 instead.
Dr. Kohli, this was breaking news this morning, so this wasn't a scheduled visit by you. We appreciate you taking time out of the day and joining us here on Zoom and giving us your thoughts.
Thank you, Drew. And I'll just say one more thing, which is that young adolescents are the highest risk for addiction. And the addiction can be up to 30% psychological dependence. So parents, just make sure you keep an eye on your teenagers.
All right. The words there from 9 News medical expert Dr. Kohli. Thanks again for being with us, doctor.